Okay. Good afternoon, everyone. I'm Pam Wycliffe. This is Lunch with the, whoops, and I'm not in the picture. And this is Lunch with the League. And on May 8th at noon. And I have a few things that I need to say at the very beginning, which we do each time we have this. The League of Women Voters never supports or opposes any political party or candidate. We're nonpartisan. We're a political organization. We encourage informed and active participation in government. We have two roles. One is voter services and citizen education. And we give unbiased information about elections and the voting process and issues. And the other is action and advocacy. We are, as nonpartisan, we do study issues. We do study issues, and after we have done that, we use our positions to advocate for or against particular policies that affect the public interest. So because of that, the comments and the opinions you might hear from individuals aren't necessarily those of the leagues. They're of the individual. We'll be here from noon till 1. And our format is that Lisa will speak for a half hour. And then after that, we'll have Q&A. And so if you would put your comments or your questions in the chat, and then I will read those to Lisa when it comes time for her to be barraged with all of our questions. Please stay muted. And also, if you want to have more information about who we are or what our positions are, you can go to lwvsouthbend.org. And if you go to that spot, you will also find the link to get to Indiana League of Women Voters and also to the national. And you can find out lots of stuff about what we believe and what, or no, not individually, but what the organization stands for and what they're advocating, and the history and all kinds of interesting stuff. We have a few things of news. One is to save the date for June 11th. That is our annual meeting and dinner. And we will meet at 5:30 till 7:30 on June the 11th at the new MLK Dream Center. So that should be really kind of fun. It's such a beautiful building. Put it in your calendars and make it a priority. We'll have food and fun, and we will elect new officers. Something else that is kind of ours, but isn't. I mean, kind of ours, but we haven't talked about it a lot, and that is League of Women Voters Lake Michigan region. They're having a talk, Who Are We and What We Do? Recent environmental developments impacting the Great Lakes. And there is a speaker, Mr. Mueller, who has 30 years, an attorney, 30 years of experience in environmental and regulatory compliance. And it will be in Elkhart. It's the Elkhart League that's hosting the talk. And so that is coming up, and I don't know when that is. I don't know when it is, but you'll just have to.
May 30,
we'll find out.
May 21st.
Oh, okay. Now you know. And something I just now learned, and that is the play Suffs. I didn't know what it even was, but SUFFS. And it's about the suffragettes and and the work that they've done. It's a musical. It's a Tony Award-winning play that is still on Broadway. Exciting news, save the date, September, Mark. Okay, and it is on WNIT tonight at 9:00 in the great performances. So it will be on tonight if anybody's interested in watching it. It's from the suffrage movement from their beginning up until the 19th Amendment was ratified. So it should be really fun. And I had to look it up because I didn't even know what it was. But thanks to Kathy Platt, I learned. Okay, and if there is no more news, I think Elizabeth Benyon put some stuff in the chat for folks to see. I don't know if I was supposed to say something. Save the date in September, mark your calendar, September 11th. Oh, I can, yeah, I'll say that. But we're going to be doing it several times, so I didn't think it was necessary to say something now. We are going to have an in-person lunch with the league in September, on September 11th, talking about the airport, any kind of changes they've had to make due to 9/11. And so we will be meeting in person at Papavino's on the side room. So if you want to come at a half hour early, like at 11:30 instead of 12, you can get yourself a lunch. And then we'll have the program from 12 to 1. Thank you, Elizabeth. I was just going to let that go until next month, but okay. All right. Coming up now is our speaker, and that is Lisa Kelly, who is the exec. Can you please send out an email with more information about the talk about Mr. Mueller? Beth, can you do that? Because you have the list of information from people of,
It's actually in yesterday's League of Women Voters news. So check your email, and the information is in that email.
okay. All right. Lisa Kelly is the Executive Director of Mental Health Awareness of Michiana, MHAM. And Lisa is a licensed clinical social worker, public health advocate, and a 2025 NASW. What is NASW?
That's
North
the
America.
National Association of Social Workers. So
Indiana
it's
Social Worker of the Year.
It's a professional
Social,
association.
okay, Social Work of the Year. Okay. A graduate of the University of Notre Dame and Columbia University, she has more than 30 years experience advancing community well-being through private clinical practice and nonprofit leadership. In 2018, she co-founded Mental Health Awareness of Michiana, MHAM, where she serves as executive director, leading national efforts to reduce mental health stigma and expand access to care across northern Indiana. And this being Mental Health Month, she will highlight the mission of the organization and talk about community impact, exploring mental health challenges. And Lisa, welcome to our Lunch with the League, and thank you for being here.
Thank you for having me. There are definitely familiar folks in this room and new faces. So thank you so much for inviting me. I want to make one correction that I did not catch when you asked me to review my bio. I would not say I lead national efforts. I would say local or regional probably is more accurate. But just so people don't have bigger expectations of who I am and what I do. But anyway, I'm delighted to be here, and I'm going to bring up my PowerPoint. I probably have more content than I really can do justice to in 30 minutes. But what I really would like to do is introduce you to our organization. So the acronym MHAM, we call MHAM because it's memorable. And then I want to talk a little bit because you are interested in advocacy and state policies. I actually do want to share some information with you about kind of what's happening on a statewide level because it is kind of interesting. And then I'll talk more about what we do and a little bit about stress and what you can do just as a positive way to end our conversation. So let me get my PowerPoint presentation up here. And are we good? Can we see that? Okay, perfect. So you know who I am. Mental Health Awareness of Michiana is a 501c3, so it's a nonprofit organization. We are the local affiliate of Mental Health America, which is a national organization that does a lot of advocacy on mental health policy on the federal level, state level, and they encourage all of us to be involved in local and state advocacy. And the area that we are primarily serving is St. Joseph, Elkhart, and Marshall counties. Although when we do big events, really anybody, in the surrounding area is welcome to participate. We've done webinars with people from other states who've actually attended different presentations that we've done. So our mission is to improve the quality of life for those living with mental illness or mental health concerns in Michiana. And we do that through programming that works to eliminate stigma, build collaboration in the community, and improve access to mental health care. So we've got some guiding principles, right? The first one is that good mental health is a critical part of overall wellness. And what we would say is that you really can't have good health without good mental health. Anyone who's struggling should be able to access culturally responsive and effective care. Access should not be limited by type of insurance or income level, and that you really need an individualized approach because not everyone is ready for the same type of help at the same time. So these are aspirational, which, it's good for us to have things that we are working towards, but I would call these values, right? These are pretty core values for us. So equity, inclusion is really a big part of what we are doing as an organization and what we're trying to push on a community-wide level to achieve community well-being. So as, kind of national statistics go, 1 in 5 Americans experience significant mental illness each year. And that is any type of mental illness. So it's a diagnosable mental health condition. Depression, anxiety really are the most predominant of the mental health diagnoses, but certainly not the only ones. There's a huge variety of conditions that are rolled into this, but the most frequent that you see are depression and anxiety. 9 out of 10 adults in America believe there is a mental health crisis going on. A third or more of adults cite personal finances, current events, and political events as significant stressors. I believe that this slide came out in 2025, and certainly that is what that said a year ago. It's still true today. And 1 in 4 adults report personal relationships as work as major stressors in their life. So that's kind of big picture what people are experiencing and what people are saying about mental health on a national level. This slide, if you remember, one of our values is that we want people to have access to care. What we have known for a long time, this slide is actually not new information. 52% of individuals with any mental illness access care. That is why they don't access care is very complicated, and we'll talk a little bit more about that. But folks with serious mental illness, there is a higher utilization of mental health support, and that might be meeting with a psychiatrist, it might be day treatment programs, it could be meeting with a therapist. Mental health care, there's a lot of different aspects to it. Folks with serious mental illness like schizophrenia, bipolar illness, they are engaging with the mental health system as they should much more frequently because illnesses like those require much more intensive care for someone to kind of maintain their well-being. But individuals with any diagnosable mental health issue, 50% is about what it's been at for a long time. So we know about 50% of people who really could benefit from care are not engaging with it. Youth, it's slightly less, but it's still about half the people who could benefit are not accessing care. So stigma is part of it, and then there's other aspects to why people don't get care. So, if we were in a room together, I would ask you what you think are the most significant barriers to care. And you probably could add them to the chat box. And this would be something, Pam, that if you want to read off, if folks are able to just, what do you think are barriers to care, to accessing mental health care? So, Kathy, as people are writing those in, maybe you could read them off to me.
One
Okay.
is money,
Money,
money.
finances. Mhm,
One is stigma among racial and ethnic groups.
mhm,
One is time.
mhm,
One is embarrassment.
mhm, mhm,
Cost. Therapy is so expensive.
mhm,
Enough providers, whether there are enough providers or appointments.
mhm,
Concern over records privacy.
mhm. Yes. So all of those are true.
Insurance
Yep.
or lack thereof.
Yep. So I'm going to go through the ones that I came up with, but you've said all of them.
Well,
So
I
out
got
of,
one more.
okay.
Unfamiliarity with the process.
Yep. Perfect. Thank
Okay.
you. Perfect. So out of pocket cost, huge barrier. And there are certain insurances and companies that provide insurance, but you may have a 3 to 5,000, if not more, deductible. So it's almost really it's for emergencies more than for anything else. But if you have not met your out-of-pocket deductible, you are paying, the negotiated rate that the provider has with the company, and oftentimes it's just very, very expensive. Not enough mental health providers and psychiatrists. Let's see here, language barriers, we'll talk more about the workforce, mental health workforce. As limited as we are with providers, the number who speak different languages is a barrier. Lack of insurance coverage for mental health care, finding an in-network provider. So you can have an out-of-network provider that you're probably going to pay full rate to. In-network providers is a whole other, thing that people have to try and discover is who takes their insurance, and that can be very, very challenging. Services not available in the evening or on weekends, transportation, stigma, distrust of the mental health system, especially among folks who, have experienced racism and kind of structural racism in the past. So these are all the things that you said are reflected on here. And I would say shame is part of stigma as well, embarrassment about having to get care. So all of
Also,
these,
another one, Lisa, I'm sorry, was
yeah, go ahead.
finding a provider who actually listens.
Oh, yeah. Yeah. So finding somebody who's an effective provider, absolutely. Absolutely. So the state of mental health in America is a report that I have been keeping an eye on for the last 8 years. So Mental Health America is a national organization. The national office pulls this report together every year. And what it allows us to do is to see how Indiana is doing in comparison to the rest of the country. We know that the items that we just identified for stigma, they're not just true of this community, they're true of the entire country. Some things are worse than others in different regions of the country, but our experience is reflected in other parts of the country. The state of mental health in America looks at access, it looks at prevalence, it looks at usage of mental health care, and it compiles that and allows us to see how are we doing as a state. So this is one of those data points that I think can be really informative, and kind of we can track it over time. So this is the title. And our ranking, right? So we can look at Indiana. This is way too small for you all to read. I can certainly send a link if anybody wants a copy of this report, but I'm going to just highlight a few things. So you've got different measures that make up the overall ranking, prevalence, access to care, barriers, all of those things are in there. We as a state in this report, 2025, we actually ranked 14th overall, which is really good. You want to be as close to one as possible, to be kind of, moving in a really good direction. So I would say this is really good news that this past report we had, moved up to 14. I'm going to give you a historical perspective in a little bit. So I want to say this is really good. There are things that are happening right now that actually are moving us in a really positive direction. When we look at access to care, right? So that's the usage of care. We start getting more into barriers. So the previous slide they included things about prevalence and youth. And this gets into what's our ranking when we start looking at access to care. So 25, I would still say not as good as 14, but still not horrible, right? So, and as far as where we land in the country, if we keep going, the percent of uninsured, we rank number 28. So 7.4% uninsured is far better than it was, before the Affordable Care Act. And as a state, you can see we're ranked in the lower half of the country for uninsured adults with any mental illness who are uninsured. And keep in mind that youth have more access through Medicaid than adults, and through kind of family plans with their adult parent. So 7.4%, we're ranked 28th. You can see where I'm going with this. As we dig in, things get a little bit worse. Adults reporting 14 or more mentally unhealthy days a month who could not see a doctor due to costs, right? So this gets at affordability. Indiana ranks number 30. And we say doctor, it's also, there's a kind of a parallel with accessing mental health care, not just medical care. So close to 26% of Hoosiers reported they could not access care because of finances. Okay, so you see that we're dropping down here as we drill in. When we look at mental health workforce availability, we are ranked 44th in the country. So this is really significant. So this 500 to 1 is one mental health provider for every 500 citizens in the state. And we've got some very rural parts of the state, and we've got some more urban parts. This is an average, right, for the state. So mental health workforce availability is a problem across the country. It is especially problematic in Indiana. So I tell you, I've been looking at these over time, and here are how the trends have gone since 2023. So the overall ranking over the last 3 years has really improved significantly for the overall ranking, right? So when I say we're doing well, something has happened in the last 2 years that has contributed to more people getting help and doing better. So overall ranking has improved. This is 2023, probably close to 38, ranked 38th, and here we are at 14th. Access to care, again, improving from the last few years. The uninsured has dropped, in terms of our ranking. And again, dropping is good. Unable to see a doctor due to costs, not much of a change. And mental health workforce, no change. So again, all of these things we've looked at as potential barriers, and you can see where there's been improvement and where things really have stagnated. I'm going to put in here a pre-COVID. So this is 2017. And again, you're seeing mostly improvement, although a little bit of irregularity, and mental health workforce actually getting worse since 2017 in terms of our ranking. So I'm pointing these out to say there are some things that are really interesting and probably important to keep an eye on in the next few years. So my speculation is that the Affordable Care Act has been really important for people getting access to insurance. So over 600,000 Hoosiers have been covered under the Medicaid expansion plan. That's NAMI is the source on that. So the access to care improvement that we have seen, I don't think that we can separate out that access to insurance, whatever that insurance is probably part of why we have seen improvement. State funding for 988, the crisis response services, has happened in the last couple of years. Indiana has been included in the Medicaid demonstration project, which increases what the community behavioral health clinics are able to do. So there are significant things that have happened that have come from the state level, but mostly it's come from the federal level. So the reason I'm kind of emphasizing this is I expect that in the next 2 years after the midterm elections, we're going to have to see what happens with the Medicaid expansion. So you probably know better than I, what the federal legislation, how that trickles down to the states and then to the local community. It takes time for it to build, and it takes time for it to fall apart. But there's good reason to keep an eye on what happens with Medicaid expansion dollars and crisis response dollars and what happens with the community health centers. So I can pause for a second here for other ideas that you might have on what has led to improvement in the last couple of years. I don't want to take a lot of time because I do want to move into how our work, is coming out of that. But does anybody have any thoughts on what else might be contributing to improvement? And just type your answers into the chat. And Pam, if you can read them, that's great.
Oh dear. Better help. Yeah. What changes have, better help online?
Right.
Check with St. Joe County Public Health resource directory. There used to be a spiral notebook. I'm not aware of any current one. New Oaklawn Center.
Yep.
Better meds. Training of volunteers in various organizations like shelters.
Mm-hmm. Yes. So what's not on here, and I'm really glad somebody mentioned it, is access to telehealth. So with COVID, a lot of providers had to very quickly learn how to transition to doing telehealth. So telehealth probably has contributed to increased access to care as well. So I really appreciate whoever said that. Okay. So all of that is background information and has informed, because I tell you, I've been keeping an eye on, what are things that are significant, and has informed what we do as an organization. So to eliminate stigma, we have tried to do community-wide classes on mental health literacy to help, folks who may be struggling but aren't sure, if what they're dealing with is bad enough to get professional help. So we do mental health literacy classes. We have large public events. So we have a big fair of, we don't want to call it fair because people think we should have rides if we call it a fair. It's a festival. And so the end of the last Friday in May at Howard Park, we've got a big festival that'll go on, and we weave in community resources and wellness activities, and kind of try to get folks to come out and just have fun, while we also are trying to teach about wellness and make sure people know about the many community resources that we have available. We do targeted topics with a collaborative approach. So we get organizations, providers together to just do presentations in the community that we think are relevant and helpful. And you'll see here, Carl Hetler is doing our next presentation on May 8th. It's going to be on de-escalation. So we try to do for St. Joe County, Elkhart County, we really are trying to bring organizations together, share what they do well, and make sure people know, when they have trouble, where to go, who should we, what should we turn to. So we definitely know that there's a demand for de-escalation, learning how to do de-escalation. The law enforcement have their own CIT, crisis intervention training, that we want more and more of them to do. But just people within organizations, the general public, people who work, in the community, this is really helpful to know if you're ever in a situation, what can you do to help bring down, kind of the temperature of whatever is going on. So we've got events like this that we do for the entire community, and we're always trying to educate the community about other resources. So we want people to know about us, but we really want to make sure people know what else is available in the community. The other big thing that we do is improving access to effective and culturally responsive care. So we want people to get the help that they need that's going to be effective. So our pro bono counseling project, we brought this to this community, but it's not the first of its kind. There are programs that exist in Maryland and Ohio. But the point of it is that folks who don't have insurance, or who may have insurance but don't have the financial means to pay out-of-pocket expenses, we want them to have access to care. So we have a network of clinicians, mental health clinicians, social workers, licensed family therapists, who are willing to take on at least one pro bono client in the course of the year. And pro bono meaning there's no cost to the client and the clinician is not getting paid. So that, up to 12 sessions, it's a short-term model, but there's a lot of good that can happen in a 12-session period for folks who need it. So we have incorporated peer support into what we do. Our Veronica, you're seeing a picture of Veronica, who is bilingual, and peer support is, the idea is that they're from the community, they have some lived experience, and they're able to provide support, help with referrals, advocacy if it's needed, if somebody's just afraid of going to, if they need rental assistance and they're afraid to go to Portage Township by themselves, she'll go with them and not talk for them, but really just help accompany them. If we have folks who just really don't know how to navigate the mental health system or their insurance, if they call us, we will actually help walk them through how to do it. And then we are working on mental health workforce development. So we've got classes that we do for providers in the community to try and bring up the level of care that they're providing. We have master's level internships for social workers and mental health counselor, folks who are getting their master's in mental health counseling. And we have a special fellowship program for clinicians in the community who want to focus their work on perinatal, so pregnancy and postpartum clients. And so we will, work with them and get them high level training to increase the number of clinicians in our community who can work with the perinatal population. So that's, in a nutshell, all the different services that we do. We also encourage mental health screening. So this is the national website, MHA National. Anybody can take a mental health screening at any time. And here's a list of the different types of screenings that are on the website. There's a QR code here, but again, I can send you, if you want, the link to, to the website. I'm happy to share that. But it's free, it's anonymous. And for somebody as a first step toward, do I need counseling? Would I benefit from treatment? This is a really good free, resource that they can use. So I want to shift. I don't know that I have much time left here, but I do want to shift towards stress, right? So we are in a time of extraordinary stress, and it's for different things. So we know that the economy is a huge stressor. Having to pay almost $5 a gallon for gas is a huge stressor for people. And financial anxiety remains the number one stressor for adults. The future of our nation, your group in particular probably feels this, it's like, where are things heading? So this particular poll, 77% of people polled said that political uncertainty and polarization are significant stressors. And I would tell you that lots of people feel that even within their own families. The rise of AI. So we are just beginning to understand AI and what the impact is going to be, but it's a new stressor for people to kind of be curious about, is this going to take my job? What's going to happen with various sectors of our economy. And then misinformation is another source of stress. So, the spread of inaccurate information is causing people strain. Can I believe what is being put in front of me? So, lots of significant stressors going on, some of which are new and some of which have been evolving over time. And we are in the Surgeon General a few years back named this, that we are in a crisis of loneliness and isolation. And the APA is the American Psychiatric Association, and their 2025 report highlighted loneliness as a defining feature of American life. So 54% of Americans feel isolated from others. 69% report needing more emotional support than they receive. So I don't know that this is news to anybody in this particular room, but we aren't doing well connecting. And the tools that were developed, with the idea that we all would be, friends and, supporting each other, they're not doing what maybe the folks who, social media companies, what they may have wanted. It's not helping us feel more connected. We're actually feeling more disconnected. So on a more positive note, in terms of ways any one of us, can recover from stress, this is a child-focused graphic, but I really like it because it really gets the basics, right? So exercise and mindful breathing, and sometimes we do need a good cry. It's okay to cry. That's not pathological to sometimes just need to let it out. Sleep, hugs, appropriately, arts, laughter, nature, friendships. Like, these are all things that we benefit. We do better as humans when we have these, we're paying attention to these and have these as parts of our life. So anybody who is stressed, I do encourage, start with the basics: sleep, exercise, nutrition. Those are things that we all can take a look at and just evaluate, are things in balance? Should I be getting more sleep? Am I taking my device to bed with me, which is not going to encourage great sleep habits? Take a look at nutrition. What are you putting into your body? That includes alcohol and any drugs, recreational or otherwise, that you might have as part of your routine. Those things can actually make our mental health worse. Connection. So connection, reflection, and joy. Spending time with people and pets who are important to you, meditation, yoga, journaling, activities that bring joy and build your self-esteem, and creativity. These are things that we tend to feel better after we've engaged in them. And then if you're feeling stuck or symptoms are making it hard to function, right? So just getting through the day, doing your work that's important to you. If you're not able to do those things because of poor mental health, that's where counseling can be very helpful, and talking to your doctor as well. So that is my presentation. This is actually the QR code, a brighter version of the QR code for the mental health screening if you are interested in doing that. This is our website, and here is an email address if you have any follow-up questions. So now it's time for Q&A. I have no idea, Pam, how much time is left.
We'll just go through and we'll see where we end.
Okay.
Elizabeth Binion put this in, and it was about the 9/11 and Mike Daigle as the CEO of the Airport Authority. And we talked about it already, that it's at Papa Vino's. Get there at 11:30, order your food. Plenty of parking. That was that. Who read yesterday's news that Beth put out? If you ordered a t-shirt for pickup on Saturday's new member brunch, these aren't even to you, Lisa, but yours are coming up, I promise. New member
You can probably
brunch.
skip those.
What? Oh, if you can't be there, text Beth North at 574-298-4987. Gosh, I'd really. And then there are some other things that people might want to read from Elizabeth that said about our annual meeting. Cynthia says, can you please send out an email with more information on the Elkhart, the talk by Mr. Mueller? And I think on the 21st and the annual meeting. And I think that was covered also. Lake
Ma'am,
Michigan.
I think you can skip down to Judy, who says it can be
I'm
done.
getting there. I'm getting there. So I'm telling people that they should just read these links. What can be done about people who refuse to take medicines? You may have seen S, a middle-aged woman who stands on the street corners in South Bend shouting in front of businesses. She used to be a bank teller. No kidding. She has been to jail and the officers convinced her to take her meds. She becomes a normal person again after she started taking her meds, but out of jail, she doesn't take it and she's back on the street. She's been banned from at least one shelter for her aggressive behaviors.
You know, we have a history of not treating people with severe mental illness well, and forcing people into institutionalizations. So, the idea of forcing someone to take medications, that's just tricky, because we tend to think that as long as somebody is not a harm to themselves or others, they should have autonomy. Um, so I think legislatively, I would be concerned if we went down that path of forcing people into treatment, because it's a slippery slope in terms of where that could end up. I do think that there are important organizations in the community for providing support to people who are experiencing severe mental illness. So the Clubhouse movement, if you're not familiar with them, they are a really great resource for individuals in terms of socialization and leading, healthy lives. It's not a top-down approach where you have case managers, kind of hounding people. It really is about community and members, being a support to each other. So, and learning life skills. So that, and, encouraging and helping, remove barriers to care. So philosophically, I'd rather people, get that sort of support, and connect with care through there than through law enforcement, as an example. I think that the sheriff's office and other law enforcement, community, they don't want to put people in jail if they have serious mental illness. They would much rather connect them to care. And, certainly the shelters that are being built, we want to get people into safe places, because certainly people who are unhoused are much more likely to experience crimes against them because of being unsheltered. So I think that all of those things are really helpful for the vast majority of people. And for folks who don't want to take the medications, the best we can do, and Carl is a phenomenal example of somebody who's willing to do street outreach and encourage people to get the help that they need. I just think that we have to be careful about what point are we forcing people to take medication, because there's not a great history in this country with what happens to people with severe mental illness, especially if they're poor and don't have advocates.
Yeah, and this comes into the next question. Is there a master list of resources and providers in Michiana? If so, how can that be made available to the community?
So I would say that most providers are on Psychology Today. So if you don't know Psychology Today, that is a resource that most providers can be found on. So that, it's a marketing tool for providers. Now, what I haven't looked at is whether providers at Oaklawn, do that because they don't need to, right? But for individual providers and group practices, you will find all of them by going to Psychology Today and just looking at, who are the providers in, say, South Bend or Elkhart, whatever area you want to look at. The problem with lists is that they change. So I was on a list because my specialization was maternal mental health, right? So that I became known as somebody who, could work with women pregnant and postpartum. I was put on a list, and the problem is that you don't, people who have that list don't know about your availability and if their insurance is accepted by the provider. So as soon as you have a list, you're going to end up with frustration. Every insurance company should have a list of who their participating providers are, but those also become outdated very quickly. So there's no good list out there of all of the providers in the community. Our pro bono coordinator has tried, as part of, she's been with us now for close to 3 years, and she has a good sense of who takes what insurance. And that includes Oaklawn, it includes Bowen, it includes all the private practices, because the type of insurance you have dictates who you're going to be able to see. And so that's what we use, right? So Linda, in all the various ways that she connects with the practices to find out, do you have availability and what insurances are you taking? And do you have a sliding scale? So when somebody contacts us and says, I'm really struggling to get a provider with this insurance, I set them up with Linda, and she tries to help them navigate who's going to take their insurance.
Okay. And what changes have we seen due to our current legislation of things, like the Affordable Care Act and some of the other changes that we've seen perhaps in SSI and those kinds of things?
The Affordable Care Act definitely, I mean, we saw the trends toward increased access, 600,000 users having access to insurance. I'm confident that has helped us as a state increase access. Now, there are two things that are coming that are one particular policy that's signed by the governor. We'll be doing a webinar on this in a couple of weeks, and I'd love your group. I'll share it with Pam or Kathy to share with your group. But the Rural Transformation Act should be expanding. It talks about expanding care to rural communities. There are some pieces of that are probably going to impact access. So what's the word I'm looking for? Medicaid, as an example, SNAP benefits, which are food benefits, there's going to be a higher burden to prove that you can't work or that you are working. So that particular piece of legislation, we think that people are actually going to become disqualified if they don't go through the process of getting their exemption or, proving to the state agencies that they have done what the state requires of them. So these are new regulations that actually will make it harder for people to stay on their benefits. So that's all rolled into the Rural Transformation Grant. And in 2 weeks, May 21st, we have somebody from Oaklawn, an advocate from Oaklawn, and Maureen Bauer are going to talk about that legislation. So it's a 1-hour webinar free of charge. And I haven't started actually sharing information yet on that because we just got confirmation. But that's one that I would keep an eye on because, making food harder for people to access, it's hard to see where that's going to take us.
Okay. I'm going to move right along here. Sue Kessam had said another place might be BetterHelp Online.
Mm-hmm.
Is that a place? Okay. And then we're going to go through these, and that was a question you asked, better training, blah, 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 blah. Beth, I don't know. This is an FYI from Beth. Beth, can people just read that themselves? People just read that because there are a whole bunch more questions. And that was by Beth. Sue Kessam, need an updated list, not something old buried in the library. They no longer keep up comprehensive community lists. Years ago, it was a wonderful opioid panel at IUSB, and that would be great to see again. Here is a question for Lisa. The recent defeat of incumbent GOP primary candidates in the state Senate likely assure more focus on priorities and policies pushed by President Trump. Senator Banks and Governor Braun, and less independence for the state legislature. How might this influence the important policies and programs you highlighted? That's kind of what I had asked up above, but not nearly
Yeah.
as well.
I know that sounds like an Elizabeth Benyon question. Was that from
It
Elizabeth?
is. It is. She asked it much better than I did when I said,
I feel like Elizabeth probably has a pretty good pulse on that. Given her, expertise. I, there's, I would be surprised if we don't see severe cutbacks with Medicaid in the Affordable Care Act, given that that's, whose legacy is the Affordable Care Act. I mean, it's been a huge improvement for people, but it's poor people who benefit most from it. So I don't really expect too many favors or legislation that's going to actually help people who are poor or people. Yeah, I know this is being recorded, but also people of color. Like I think anything, that's really helping, marginalized people, I wouldn't expect more money to go toward it. I would love to see people from the community be encouraged to go into social work as a profession. There is a demand for social work, and there are right now some things in the high schools that are trying to get kids to think about social work as a profession. Indiana Tech and Ivy Tech, I think, have a role to help kids get from high school into four-year colleges like IUSB, and for the graduate programs to really incentivize people to go into helping professions. So I know Goshen College's social work program that's virtual, which is, some people that's not going to be great, but it also keeps it more affordable. So getting more community members trained to become providers and to become social workers, there's no shortage of work. So how the federal funding and state funding, I mean, we saw federal funding say social work as a profession isn't legitimate. It's like that was part of the, you can't get X amount of loans. So so if they're following the lead of the federal government, it's not going to be supportive of the things that probably would make the biggest difference. But Elizabeth, I would be really curious to hear what you would have to say on that question.
But she can have to answer that later because we have a whole bunch more questions.
Okay.
I heard an article that people are actually speaking less to each other by 200 few spoken words daily. 28% overall and 40% for youth. How this contributes to the crisis of loneliness. Can you comment on this, and how can we talk more to each other?
It's that's technology has done that for us. The thing that was supposed to help us be more efficient, means that we don't need to talk to each other. Yeah, I mean, I totally agree that it's, and I find myself doing the same thing, that, responding to emails certainly feels more efficient than returning phone calls. So I'm probably in that category too, of people who talk less because I can email people quite, more easily. So, our kids, the youth, like they're learning an entirely different way of interacting with each other. So when I was in high school, we had a phone attached to the wall, and that's how I reached out to my friends, and we got together. And that just isn't happening. They're communicating with each other in group chats and virtually, and they're just not getting together the same way. And I think they're really missing out. But that's part of their culturation, at this point. They're how they're being trained, to interact with each
Okay.
other.
Okay. And Sue also said Middlebury identified 4,700 had thought of suicide out of 4,700 thought of suicide, and they added horse therapy. And it's discussed on inspiringgood.org. And we won't go into that. You can just nod your head and say, yeah, that's right.
Yeah, well, animals are really important. And I think that the horse, the equine therapy is fantastic. I think for returning citizens, people who've come out of the incarceration, it's been great. For PTSD and veterans, it's been great. But I think
Okay.
that, connecting with animals and nature actually is something that we probably all need to be doing more consciously.
Okay. Okay. Because we're running out of time, but we still have a bunch of questions. So, to what extent are clergy still in the counseling mix for the mental health space?
I would say that clergy are still really important to community members whose faith would have them lean in more toward their pastor than professionals. But I think a lot of pastors in the community, religious leaders, are seeing that they cannot do this by themselves. So we are seeing more requests for professionals coming in and talking about mental health.
Okay. Is there a psychiatrist in the South Bend area who specializes in treating older adults?
Not that I know of. We are in a shortage in this community of psychiatrists. So there are psychiatrists, but as far as specializing in geriatric, I don't know of one.
Okay. Do you work with the I Am Power Center on therapeutic third Thursdays? Each third Thursday, licensed therapists meet with with anyone who comes to discuss a set of topics in group therapy format.
Mm-hmm. So yeah, we've met with Empower and are working on trying to find ways to collaborate.
Okay. I fear for S. Oh, and this goes back to the lady.
Mm.
Well, that we can just read that. Judy is worried about her because one day someone who doesn't know her to slug her, or they might harm her, and she's the one that was
Yeah, I
left
know,
out of.
I know who
You
she
know
is.
S.
Yeah.
Okay. Do you work with the family medicine residencies at Beacon and St. Joe Health Systems?
Uh, they know about us, and we certainly work with the hospital social workers. So we get referrals from both hospitals.
Okay. SJC has around 43% Alice poverty rate, high stress, probably less access, which is an issue for our overall mental health in our community. That's a statement. Here's a question. Here's another Elizabeth question. So get ready. How do we get more mental health providers to get to know their patients, understand the roots of their distress, and encourage the healthy approaches to well-being that you advocated instead of simply prescribing a pill? Next, background information. And
So
so then,
any,
and then the rest of it, I
oh,
think people can read. But
okay.
that was the question.
So here's what I would say. Any mental health clinician should be doing what you described, getting to know their patient and doing it in a way that's respectful and listening, right? So mental health clinicians, that is part of providing good care. Medical professionals like psychiatrists, um, they the approach that they have to take because of how their businesses are run is paying them for volume, not amount of time. So it is incentivized for them to spend as little time as possible to increase the number of patients that they can see in an hour. I don't think that's what psychiatrists went into the business, to do. I don't think that's why they became psychiatrists, but that is what most of the health systems, the pressure that they feel, especially if it's a system that is run by, kind of a more of a business model. So that's my opinion on that, but I think it's also the reality.
Okay, and if folks want, if there was something you said you could send the link to, and I don't remember now what it was, but if you could put that in the chat, that would be wonderful for people to see.
I'm going to stop sharing. Let's see
Okay,
if I can get it.
and if you could put that in the chat, because people can look at this, they can watch this again. The video will be available online at our website and also on Facebook. Um, and that said, it's 1:00, 1:02. So we want to thank you, Lisa, very much for all that wonderful information, um, and for being with us and sharing all the stuff you know, and for giving us your time.
All
Thank you
right.
very much. And
Thanks for having me.
thank you everybody for coming. And next month we will have another one on the second Friday of the month.
So
And thank you
when,
all.
if it's
What?
okay, Pam, I would like to, I don't have a flyer to share this second, but I would like to share about the two webinars that we're going to do to explain some of the policies and and one of them, I know you've had Sheriff Redmond on to talk about the criminalization of homelessness. That is another one that we're going to do.
How can you do that? Can you put that in the chat?
Uh, so I need to actually send it to you to distribute. I can't do
Oh,
it right
okay.
this second.
Okay, we can do that. Can't we,
Okay.
Beth?
Yeah.
Okay. Thank
Thank
you
you.
all for coming. Have a wonderful day. It's sunny outside. Enjoy it.
Bye-bye.
Bye.